My name is Esther Fasan. The title of my presentation is Understanding the Factors Influencing Cycling Among Secondary School Adolescents in Birmingham. This project was carried out in collaboration with my supervisors, Professor Tite and Dr. Wright. There's a global trend of physical inactivity worldwide. This trend is particularly concerning among adolescents, as the World Health Organization reports more than 80% of adolescents worldwide are physically inactive. Similarly, another study conducted by Guton reported 81% of male adolescents are inactive and 84.7% female adolescents are inactive. In England, only 22% of children and adolescents are sufficiently active, according to the World Health Organization. The insufficiency of physical activity among adolescents increases the risk of non-communicable diseases such as diabetes, obesity, cardiovascular diseases, which further increases mortality rate worldwide. In recent years, various policies and guidelines have been proposed to increase the level of physical activities among children and adolescents. This includes the World Health Organization recommending for adolescents to engage in a minimum of 60 minutes of moderate to vigorous physical activity every day. However, recent reports show that adolescents in developed countries, including the United Kingdom, do not meet the recommended physical activity guideline. Several studies have recommended active transport, which includes walking and cycling, as a means to increase physical activities among adolescents. The figure shows higher walking trip rates among children and adolescents in UK in comparison to cycling. However, cycling is more intense, thereby providing greater opportunity for adolescents to meet the recommended guidelines. Also, studies have found adolescents who cycle to school are more likely to meet the recommended physical activity guideline. Furthermore, cycling provides the opportunity for adolescents to cover longer distance independently. Considering that secondary school adolescents are at a crucial phase for the development of healthy lifestyle, norms, and beliefs, it's important to inculcate cycling as a transferable skill. This will help them transition from their car-centric culture to adopt cycling in adulthood. This study was conducted in Birmingham City, which is currently the second largest city in the United Kingdom, with a population of over 1 million people, out of which 22.7% of the population is made up of children aged 0 to 15 years. Furthermore, Birmingham is culturally and ethnically diverse. The city has adopted the West Midlands Cycling Chapter, which presents a vision to increase the level of cycling in West Midlands from a baseline of 1% of all travel to 5% in 2023 and 10% in 2033. Specifically, Birmingham has developed a 10-year walking and cycling plan to make walking and cycling a daily choice for short distance travel. This is in line with the government's aim to make walking and cycling the natural choice for short journeys. In this research, both quantitative and qualitative data were collected and analyzed independently. The quantitative data comprises of the analysis of questionnaire data from 550 Birmingham secondary school adolescents, which was aimed at understanding the factors influencing adolescents to cycle for school and non-school travel, while the qualitative study entails 14 transport stakeholders promoting cycling among secondary school students in Birmingham. In the quantitative study, 50.5% were female respondents. Most of the respondents were not non-white British. Birmingham is an ethnically diverse city with an estimate of over 50% non-white British children and adolescents. The sample provides valuable insight into factors influencing cycling in an ethnically diverse population. 85% of the adolescents lived in a household with at least one car or van, and over half of the respondents had a bicycle. In this sample, bicycle ownership was higher among boys than girls. Approximately half of the students have completed a cycle training, of which similar proportion of boys and girls reported having been trained to cycle. Active travel was mostly used to school. However, in comparison to walking, cycling rates to school was low. 81.5% traveled 20 minutes or less to school, and over half of the respondents traveled under 2 miles to school. This shows a large proportion of adolescents living within cyclable distance. Walking was the most preferred mode of transport to school, which was followed by car. However, only 5.5% of the adolescents preferred using the bicycle as a mode of transport to school. In addition to school travel, selected non-school travel modes were examined in this study. This includes friends and family visits, sports activity, grocery shopping. The result shows an higher use of the car for non-school travel than for school travel. Overall, cycling for school and non-school journey was low. However, in comparison to school travel, there was an increased use of cycling for non-school travel. Boys were more likely to cycle at least once a week to school and to non-school destination. Also, adolescents who owned a bicycle were more likely to cycle at least once a week for school and non-school journeys. Less than half of the students agreed cycling is an important form of transport. However, over half of the respondents agreed they enjoyed cycling. About 48.3% agreed they are confident to make journeys using the bicycle. Adolescents were asked to provide reasons why they would not consider cycling for school and non-school travel. A total of 419 adolescents responded to the open-ended question, providing various reasons they would not consider cycling. The result shows safety concerns was the major reason students would not consider cycling. These safety concerns include concern about being involved in an accident, getting hurt and injured, falling off the bike, concerned about being attacked, kidnapped, and robbed. Further safety concerns include concern about busy roads and traffic, and a generic perception of cycling as dangerous. Apart from safety concerns, adolescents associated cycling with too much hassle and hard work. In previous studies, short distance has been identified as a motivation to cycle, while long distance has been reported as a barrier to cycling. However, in this study, both short and long distance were reported by the adolescent as a barrier to cycling. Also, students were asked to provide reasons why they would consider cycling to school and non-school destinations. A total of 424 adolescents responded to the open-ended question, providing various reasons they would consider cycling. The most important reason students will consider cycling is for exercise and health benefits, which was closely followed by the use of the bicycle being fast. In this slide, we present results of the adolescent cycle safety perception. Over half of the adolescents reported they perceive cycling to school as safe and cycling within their neighborhood as safe. There was a statistical significant association between gender and safety perception of students to cycle to school. Boys were more likely to perceive cycling to school and non-school, and cycling within their neighborhood as safe. The study further investigated factors to increase student perception of cycling safety to school and in the neighborhood using open-ended questions. The analysis of the factors obtained from the open-ended responses shows cycling with someone and the provision of cycle lanes were the most important factors to increase safety, to increase their perception of safety to cycle to school. Similarly, cycle lanes and cycling with someone were the most important factors to increase perception of safety to cycle in the neighborhood. The results show the provision of adequate cycling and having someone to cycle with would increase the perception of cycling among adolescents. The qualitative study comprised of 14 transport stakeholders. In this session, we present findings from the semi-structured interview conducted with local transport stakeholders responsible for promoting cycling in Birmingham secondary schools. The purpose of this phase of data collection is to identify the factors that influences the adoption and promotion of cycling among secondary school adolescents from the perspective of the local transport stakeholders. The interview highlights participant experiences of promoting cycling, thereby providing insight into some factors that influence cycling among secondary school adolescents. The interview consists of 14 cycle transport stakeholders, which were broadly classified into policy and regulation stakeholders and advocate stakeholders. The advocate stakeholders consist of cycle training instructors and non-governmental organizations. In the policy and regulation category, there were 3 participants. In the cycle training instructors, there were 5 participants, while in the non-governmental organization, there were 6 participants. The data was analyzed thematically based on the socio-ecological model. 5 distinct themes emerged from the analysis of the data, and these are individual factors, interpersonal factors, organizational factors, physical and environmental factors, and policy factors. In each of these broad categories, various sub-themes were also identified. Under the individual factors, student herd mentality, appeal and enthusiasm of students towards cycling, lack of cycle training, access and condition of student bikes, sweat and uniform, gender imbalance, and image. These were the factors that were identified under the individual factors. Under the interpersonal factors, family influence was identified, and with the organization factors, limited access to schools, school safety concern, and the influence of teachers, motorized transport choice were identified. With the physical and environmental factors, 4 sub-themes were identified, including concerns around cycling infrastructure and the attitude of road users in Birmingham, distance, weather, and safety factors. With the policy factors, 3 main sub-themes were identified, which include non-existence of specific government policy, irregularity of funds, and the insufficiency of cycle training instructors. In this session, we compare some of the results from the quantitative and the qualitative findings. The quantitative findings show that girls were more likely to prefer walking to school, while boys showed more preference for cycling to school than girls. In the qualitative study, participants highlighted that for girls, there's a bit more of a social thing for the journey to school. They will meet up and want to chat to and fro school. Cycling would mean that they aren't socializing on their way to school because all their friends are walking and they are cycling. They are not going to be chatting to their friends. So that factor showed the concerns of the female gender when it comes to their journey to school and the need for them to socialize when walking, when cycling through and post school. The second factor that was also looked into was the increase of car travel for non-school destination. In the quantitative study, it was observed that car travel was substantially higher for non-school travel than for school travel. Participants in the qualitative study also highlighted that non-school destinations are often car-dominated environments and are designed to get lots of cars there and are often around the busy areas of the city. This just shows the reason why, non-school travel, car travel was higher for non-school travel. In conclusion, factors influencing cycling among secondary school adolescents is multidimensional, and this will require a multifaceted approach to increase cycling among secondary school adolescents. Thank you for listening.